How to know if you need iron supplements. Lately, many companies stress through advertisements the need for supplements for our body, suggesting supplements could help us work through a regular day. Further, supplements are also suggested as common solutions for tiredness and stress, or are even recommended as substitutes for certain meals. However, it is very important to make sure we be very careful of what goes in our mouth, simply because an excess of certain vitamins and minerals and/or less of another could lead to an overall imbalance. It's therefore vital for us to recognize the importance of certain vitamins and minerals first before subscribing to them. This cannot be more true for iron. Steps. 1. Know the function of iron in our body. Iron helps to transport oxygen to body tissues and pick up CO2 for exhalation. Common sources of iron in our diet include meat, especially red meat and poultry, seafood, whole grain bread, cereals, and also some green leafy vegetables and some sugar-cane products such as jaggery. 2. Recognize that the need for iron, however, varies greatly during the life cycle. Some children who grow quickly need a higher intake of iron along with a properly balanced diet. Iron is also important for a healthy blood system. 3. If you are female, don't assume your need for iron is the same throughout your lifetime. Dietary iron requirements vary in women. Pregnant women need a good supply of iron but should take supplements only under strict guidance from their doctors. Since iron deficiency is more likely when people lose blood, women losing excess blood during menstruation periods, menorrhagia, may also consider taking some mineral intake. It may be the case for some women that are losing a lot of blood during their monthly periods that they develop iron deficiency. This group is considered by some likely to be iron deficient than other groups of adults. 4. Be aware that people with medical conditions such as bleeding ulcers or hemorrhoids or other conditions that involve blood loss may benefit from iron supplements. 5. Take assurance from research if you are an older person. Researchers at Tufts University revealed that older adults are actually more likely to have too much iron in their bodies. However, it's worth having timely checks for other deficiencies that come with age such as calcium. At the same time, among older people suffering from malabsorption, iron might be an important supplement to keep their blood system fit. If the acid is not there, the iron doesn't get absorbed and we can become deficient. 6. Know the true symptoms of a lack of iron. Some people worry about anemia, or a serious lack of iron in the body based on some very non-specific perceived symptoms. Cautions must be taken. Fatigue and weakness, for instance, are also a result of daily activities or a stressful schedule. People who do require iron due to anemia usually suffer from a combination of all the symptoms including extreme fatigue, pallor, paleness of conjunctiva, tongue, nail bed, skin, weakness, shortness of breath, headache, light-headedness, and often cold hands and feet. 7. If you have any of the following medical conditions, consult with your physician before you take iron supplements. Kidney infection, liver disease, current or past alcohol abuse, rheumatoid arthritis, asthma, allergies, colitis or other intestinal problems, heart disease, or stomach ulcers. 8. Eat healthy meaty food. For vegetarians, spinach, black-eyed peas and molasses are a good option. Tips. If you are concerned that you are not getting enough iron, it is highly advised you talk to your physician or doctor. Warnings. A long-term use of an iron supplement when it is not needed can also cause significant liver disease, called hemochromatosis. Do not try to mix too many supplements as it can be fatal, especially for older people.